Hi, I'm Dr. Craig Castanet at Backstrong Clinic in Decatur, Georgia. Am I the best chiropractor in Decatur, Georgia? It's a silly question, but I pose it because I will tell you that I do have a unique perspective on what causes neck and back pain, and I might be the best chiropractor for you. And let me tell you my frame of reference here for this issue. Neck and back problems are generally the result of this very slow, progressive, degenerative, compressive process. It is by nature, anatomically, physically, mechanically, a compressive process. Discs wear out over time. This starts in childhood. Typically by the time you're in your 30s or 40s, it will become symptomatic occasionally and typically be self-limited and get better, so you don't necessarily have to treat it, although for some people they will. It's a function also of little traumas and things like that. But typically those acute injuries will get better on their own. But as this slowly progressive degenerative process accumulates degenerative changes, your threshold for provoking pain will be lowered, and it's easier for you to do something that provokes pain. So this degenerative spine becomes more and more frequently symptomatic with less and less demanding provocations, and will often force people to treatment eventually. Most of the patients I see here are probably in their 50s, 60s, 70s. I see some in their 20s and 30s, and I see some older than that in their 80s, and infrequently in their 90s. By the time you're in your 90s, even if you've accrued a lot of degenerative changes, usually you impose so few demands on yourself that you're not exacerbating your symptoms and pain all the time, and you're so limited in your ability that you don't do the sorts of things that will provoke pain. Anyway, getting back to the primary issue about whether or not I'm the best chiropractor for you, because of my understanding of this problem, this cause of back and neck pain, and I think it's the most parsimonious explanation for why people have neck and back pain. I worked, I should tell you, for 36 years in practice. 18 of those years were in orthopedics and physical medicine and physical therapy. I spent 5 years with a neurosurgeon. I've treated over 40,000 people or participated in their treatment. I've looked at imaging and all that sort of thing. When doctors look at imaging, whether it's x-rays or MRI or CAT scan less frequently, we note and we look for lesions that are compressive in nature, whether it's a disc bulge or herniation that compresses a nerve root, or whether it's a partially collapsed disc that may be a source of pain or causing subsequent joint pain because the joints are then jammed together more, or maybe there's an instability, a spondylolisthesis, which tractions and or compresses nerve roots in the canal. All of these are compressive in nature, and the most effective non-surgical means of treatment I have found clinically, and this is by a large measure, is to decompress people. And it's not to put bones back in place, which is what chiropractors often conceptualize and tell patients, because it's a simple understanding of how they might help. And we do argue somewhat about how it is we may help when we do. And physical therapists will typically teach you exercises, etc. But we're all working in the context of this slow, progressive, degenerative compression. So decompressing the spine intermittently when you have these bouts of neck or back pain shouldn't be surprisingly the most effective treatment, and it has been in my experience. So I place you on a very sophisticated traction table that we call spinal decompression. Older traction tables are often very crude, and as a result, not easy to use, not comfortable to use, not comfortable for the provider or patient, and not very effective as a result. This new spinal decompression traction, which I've used for the last 17 years now, is, in my experience, the best means of treatment I've ever used. And I've used rehab and all the passive modalities, exercises, manipulation, things like that. This just does, I think, what needs doing, And as a result, it works faster and better and lasts longer than other means of treatment I've ever used. So if I can help you with your neck or back pain, I'm Dr. Craig Castanet in Decatur, Georgia at Backstrong Non-Surgical Rehab Clinic, and maybe I am the best chiropractor in Decatur. Thanks very much. Bye-bye.